Hello, my name is Jesse Dickinson. It is May 3rd and 2026, and I'm going to do my short video presentation on compartment syndrome. Here are some notes I have. Nothing on the back. I'll set that here. So, compartment syndrome is when a closed fascial compartment around a muscle, when the pressure gets so high, that compartment um, the pressure is so high inside that compartment that the blood flow can't adequately perfuse the area, and also oftentimes you won't get a distal. It won't distal to the insult, the area of the compartment. You won't get a pulse as well, so you won't get blood flow to that. We diagnose it with the 6 P's. They are pain, pallor, paresthesia, paralysis, and pulselessness. Pain, pallor, paresthesia, pulselessness, pressure. I think I got them all. Um, so pallor is like the bad color of this due to lack of perfusion. Paresthesia is the lack of feeling due to nerve damage. Pain, obviously, from the pressure. Paralysis, it's weak or unable to move that limb. And then pulselessness, like I described, pressure occludes the arteries and vessels in that limb. It often causes of compartment syndrome are like a trauma, like a long bone fracture, that causes blood and edema to that area, blood flow or blood leakage, edema to that area, trauma, localized trauma that swells that to the point where the blood flow is compromised. A crush injury could be another one where there's not a bone fracture, but the muscles get crushed, and then the swelling, subsequent swelling. Usually, these compartment syndrome takes hours to manifest itself fully. Um, and Another one is trying to think. Sorry, a common reperfusion injury. So like if you have blood flow that is limited to an extremity, and then like a surgery is performed where the artery is reopened, then the blood flow that comes back in there can release all kinds of cytokines and reactive oxygen species that can cause damage to that area and create compartment syndrome. Some confusing other diagnoses that are similar but different are like a DVT. It'll have the swelling, but it won't be hard, right? Well, it could, but also won't have the pain out of control, like out of proportion with the injury. Peripheral artery occlusion will have the pulselessness and the weakness and the pallor and stuff like that, but it also won't have the same level of pain, and it also will be soft. It won't be hard like a compartment syndrome situation will. Rhabdomyolysis is another one that could mimic it, but rhabdomyolysis is usually more global, kind of like from heavy exertion. So like if somebody did a whole bunch of squats and they overdid it, both of their legs would be that way rather than just like one spot where the injury occurred. So that's another important thing to notice. It is a medical emergency. Within 6 hours, tissue is going to be dying. So it's pretty important to get on top of it. As far as treatment goes, prophylaxis is real important. Fasciotomies are performed, frequent reassessments to check pulses, neurovascular assessments to check pulses, and make sure that you haven't lost perfusion, and doing a stretch test. Checking compartment pressure is something that can be done. That's an objective measure we can do, and compartment pressure should be like under 8 millimeters of mercury from my studies. And as long as the blood flow to the muscle is not compromised overly, and pulses are maintained, then a fasciotomy is not necessary. But if it gets to the point where there's cellular damage due to lack of perfusion, then a fasciotomy will have to be performed, where they cut into the limb and release the pressure, allow the muscle to expand and blood flow to get through that area. Um, so yeah, that's my short video presentation on compartment syndrome.